There are two types of heart failures, and that is if we divide it into on the basis of sides of the heart, there are two types: right side of the heart failure and the left side of the heart failure. Right side of the heart failure, when there is right side fail, and that results in different signs and symptoms, and that's known as right side of the heart failure. So mnemonic is ahead, and that is anorexia and nausea will be felt by the patient. Weight gain is also there, and then hepatomegaly will be there because result from engorged vein and increased pressure, and also other signs and symptoms. Edema will be there in the bipedal edema, and the patients will be there in right side of the heart failure. Ascites, abdominal distension with accumulation of fluid in the peritoneal cavity. Then distended neck vein. This is known as distended neck veins will also be present in the right side of the heart failure patient. Now let us look at other slides of right side of the heart failure. Okay, in this slide we can look at right side of the heart failure. There are bloating, anorexia, cyanosis, oliguria, nausea, edema, pedal edema, and distended neck veins in the right side of the heart failure. In left side of the heart failure, there is fatigue, orthonia. Patient will become dyspneic when patient becomes supine, stand up, rails, cyanosis, extreme weakness, and dyspnea will be there because pulmonary fluid will be accumulated, and that's why. Okay, let me show you left side of the heart failure patient signs and symptoms. There are proximal nocturnal dyspnea patient will be there, restlessness, elevated pulmonary wedge capacity pressure, pulmonary congestion, tachypnea, cough, cracks, rectal swells, and exertional dyspnea will be there in the patient of the left side heart failure. So in this way, patient of the left side heart failure will present. So these are some signs and symptoms, and also we perform ECG to look at the signs and symptoms and any derangement in the ECG electrocardiography, and we will evaluate according to that. And in treatment protocol, we prescribe certain medications like upright position for the patient, and then we can give nitrates, lasix to decrease fluid, oxygen supplements, ACE inhibitors, and digoxin to increase cardiac inotropy. Fluid should be decreased, afterload will decrease in the patient, and sodium restriction is done because there is already accumulation of the fluid. So we have to restrict the sodium for the patient, and we have to look at the potassium level in the body in order to prescribe digoxin dose. So in this way we treat the patient and solve the cardiac issue. Then there comes valvular heart disease. Heart is divided into right side and the left side. Two atrial and two ventricle are there. The interatrial and interventricular septums are right side tricuspid valve, left side bicuspid valve or mitral valve. When ventricles give blood to the pulmonary artery carrying the oxygenated blood, there is pulmonary valve and aortic valve on the left side. In this way, blood pumps across the heart through atria and ventricle through different valves: mitral, aortic valve, and pulmonary valve. So whenever there is stiffness or any regurgitation, murmur is developed. There's very important point to memorize that what kind of murmurs are there in the what kind of valves are involved in the murmur. Now, high blood pressure or hypertension, it is a condition in which there is increase in the blood pressure, systemic pressure, and vasoconstriction of systemic arterioles and veins, resulting in increased blood pressure. Systolic blood pressure is more than 130, and diastolic is more than 80. So in this way, blood pressure is increased. Now there are different types of hypertension like essential hypertension, secondary, malignant, resistant, refractory, potassium hypertension, white coat, mild hypertension, and labile hypertension. These are different types of hypertension in which different types of the patient present with the increased pressure. So high blood pressure, there is increase in the systolic and diastolic blood pressure, that is known as hypertension. There are different types of hypertension. The one is the primary hypertension and another secondary hypertension. Primary hypertension occurs because of certain causes. Secondary hypertension occurs because when the problem lies in any other center, in any other system, like in suprarenal gland, any tumor, mass, pituitary gland related hypertension, or any cardiac issue related hypertension. So that is known as secondary hypertension. How do we treat hypertension? We give drug therapy to the patient like methyl dopa, alpha 2 receptor blockers, ARBs, diuretic for decrease volume of the blood, and ACE inhibitor for decrease uh, captopril for decrease vasoconstriction. In this way, we manage hypertension in the patient. Also, lifestyle modification, salt and oil restriction we should be given, and physical activity is necessary to manage hypertension. As you can see in the slide, there's gender, which is more involved in the men, and age. In high age, hypertension increase. Obesity, obese people are more prone to develop hypertension or any genetic issue. Smoking should be stopped. No alcohol, no extra caffeine and salt. With oil, spicy food or junk food like pizzas, burgers, these should be avoided. And then, if any cardiac anomaly is developed at the time of birth, that is known as congenital heart disease, before birth or after birth, that is known as congenital heart disease. So, congenital heart disease involved teratology of fallout, and in teratology of fallout, there are different signs and symptoms.